Neurological emergencies can involve misfiring of the nerves or nerve malfunction caused by an underlying issue. Both present serious health issues and can severely affect a patient's mental status. An altered mental status is a critical indicator of a patient's condition. It can signal serious underlying problems and can mark the deterioration or improvement of a patient during the course of your care. Seizures and strokes are among the most serious conditions a patient can suffer that involve neurological malfunction. Both can be life-threatening and require immediate action on your part.
Paul, are you okay? Paul! Paul!
In this program, we will present neurological emergencies, how to recognize an altered mental status, and how to provide emergency medical care for seizures and strokes. The training objectives are to describe common causes and management of an altered mental status, to present causes, assessment, and care for seizures, and to present causes, assessment, and care for strokes.
My name's Andy. I'm with the fire department. How are you doing today?
Fine.
Fine?
Fine.
An altered mental status is a medical condition in which there is a decrease in a patient's alertness and responsiveness to their surroundings. It has many causes. You should be alert to any changes in your patient's mental status throughout your care. A decline in mental status can signal a serious life-threatening event. Common causes of altered mental status can include inadequate oxygenation or ventilation, diabetes, infection, poisoning or overdose, behavioral illness, and head injuries. You may see inadequate oxygenation or ventilation in any patient experiencing respiratory compromise. Medical conditions such as diabetes or infection can cause a change in mental status, as can poisoning or overdose.
Hey man, how's it going?
When assessing medical patients, suspect first an underlying medical cause. For example, a diabetic patient may appear intoxicated when he is actually experiencing a serious medical emergency. For behavioral illness patients, an altered mental status can signal that a scene is potentially unsafe. Your safety is priority one. Keep alert at all times for any risk of danger.
You seem really ramped up, more than you normally are.
In trauma patients, be alert for head injuries. Even a seemingly small injury event could result in an altered mental status indicating severe trauma. Assess every patient's mental status. Using the mnemonic AVPU, assess the patient's mental status.
Kiddo, what's your name?
Calvin.
Calvin, what happened?
Calvin, keep your head still.
You will evaluate for alertness, response to verbal stimulation, response to pain stimulation, and unresponsiveness. In pediatric patients, note the mechanism of injury or the nature of illness for clues about the causes of altered mental status. Inquire into the child's history of illness, such as whether he has diabetes or a seizure disorder. Monitor vital signs for indications of shock that could cause an altered mental status. For geriatric patients, determine whether the patient's mental state is normal for her. If the patient normally experiences confusion, she may not have an altered mental status.
Okay. Everything that she's saying seemed to match with what you know of her? Her birth date, normal breakfast?
Pretty well.
On the other hand, if she is normally clear thinking, this could be an indicator of possible stroke or other medical condition. To manage altered mental status, control any life-threatening conditions. Arrange for EMS transport. Maintain a patent airway, as a patient with an altered mental status may not be able to do it himself. Closely monitor the airway. Provide suctioning when necessary. Provide oxygen according to your local protocols. Be prepared to ventilate if necessary. Seizures are sudden, temporary alterations in a patient's mental status or behavior caused by irregular electrical discharges in the brain.
Paul, are you okay? Paul! Paul! Oh my! Paul! Paul!
Seizures are distinguished from convulsions, which are uncontrolled muscle contractions that can be caused by seizures. Most seizures last only about 1 to 2 minutes, but they can be extremely frightening to witness. The 4 most common types of seizure fall into 2 categorizations: generalized seizures and partial seizures. A generalized seizure causes the entire body to convulse. Partial seizures may include little or no dramatic body movements. The 4 common types of seizures are the tonic-clonic seizure, the simple partial seizure, the complex partial seizure, and the absent seizure. The tonic-clonic seizure is a generalized seizure that includes unconsciousness and full-body muscle convulsions. There are 3 phases involved in this kind of seizure. In the tonic phase, the body stiffens. Breathing may stop, and the patient can become incontinent. In the clonic phase, the patient convulses. He may foam at the mouth, drool, and become cyanotic. In the postictal phase, the convulsions stop and the patient regains consciousness. He may be drowsy and confused and complain of having a headache. The simple partial seizure involves tingling, stiffening, or jerking in just one part of the body and does not include the loss of consciousness. It may include an aura, a sensory perception the patient has before a seizure happens. An aura may include visual disturbances, sounds, odor, an odd taste, or other sensations that serve as a warning that a seizure is imminent. The complex partial seizure involves abnormal behavior, such as confusion, a glassy stare, aimless movement, fidgeting, and lip smacking or chewing. It does not include the loss of consciousness, but the patient may have no memory of the episode afterwards. It is often preceded by an aura. The absent seizure is a brief event lasting only a few seconds. The patient will not exhibit any dramatic activity and will only experience a temporary loss of concentration or awareness. Typically, an absent seizure is not noticeable by others. A seizure is not a disease, but a sign of an underlying condition that caused the seizure.
Here they come.
Kevin, why don't you go ahead and take the patient? John, would you take over for her and help support the patient get ready? You might need some O2. Ma'am, if you could step over here with me. Sir? Let these guys come in and take over.
Common causes of seizures include injury, infection, disease, or an underlying defect in the brain, such as epilepsy. The most common cause of seizures in adults is the failure to take anti-seizure medication. In children, the most common cause of seizures is high fever. Other causes of seizures include toxins, hypoglycemia, heat stroke, and hypoxia. If you do not witness the seizure, try to obtain as much specific information as possible from bystanders. Ask whether the patient has had seizures in the past and why.
Hey Ed, this is his first seizure. Can we get an ALS upgrade, please?
You bet, you bet.
Ask what the patient was doing before the seizure started and exactly what he did during the seizure, especially at the beginning. This information will help with later emergency treatment.
Okay, Paul,
Find out how long the seizure lasted and what the patient did after the seizure. For example, he might have been sleepy, disoriented, or unable to answer questions. If you do witness the seizure, there are common signs and symptoms you will be able to observe, though they may differ as a result of the underlying cause of the seizure. The signs and symptoms of a seizure can include spasms, or an uncoordinated series of muscle contractions, tongue biting and increased secretions from the mouth, sweating, cyanosis, unconsciousness followed by a gradually increasing level of consciousness, shaking or tremors with no loss of consciousness, incontinence, and amnesia of the event. To manage a seizure, your care will change depending on whether you are present for the event or not. If the event is a convulsive seizure and you are present, loosen any restrictive clothing and remove nearby objects that could cause harm to the patient. Restraining the patient during convulsions is not recommended. In some cases, however, you might be able to gently hold a thrashing arm to prevent injury. Avoid putting anything in the patient's mouth, even if you think it is necessary to protect the tongue. The object could damage the teeth or obstruct the airway. When the convulsions have ended, first assess the ABCs. Be prepared to suction the airway if necessary, as the patient will likely be drowsy and weak. Administer oxygen according to your local protocols. Provide ventilations if needed. If this is his first seizure, activate the EMS system. If there is a history of seizures, contact the patient's physician for further direction. Allow the patient to remain at rest and expect him to be confused and disoriented. Provide emotional support while you wait for further assistance to arrive.
Let's roll him over onto our side here. So if you want to come over here, we'll roll him over. We're going to roll you onto your side, okay, Matthew? All right, we're going to do all the work for you, so you just relax.
Place the patient in the recovery position to protect the airway and to facilitate drainage from the mouth. A stroke is the rupturing or the blockage of an artery in the brain that disrupts the supply of oxygenated blood to a portion of the brain.
Fire department. Hello, sir. Where is she? Over here?
A stroke caused by a blockage in an artery is referred to as an ischemic stroke and is the cause of most strokes.
What seems to be going on today?
I don't feel very well.
Okay.
This is commonly seen with elderly patients whose buildup of plaque deposits in the arteries can result in arterial narrowing and a reduction in blood flow through an artery and the part of the brain it supplies. A stroke caused by the rupture of a blood vessel that results in bleeding in or at the outer surface of the brain is referred to as a hemorrhagic stroke. This kind of stroke is often associated with patients who have high blood pressure that weakens the arteries, leading to the rupture. In some patients, the underlying cause is a structural defect that has been present since birth. The signs and symptoms can differ with stroke victims depending on the kind of stroke involved and the size and location of the vessels involved. It can be difficult to distinguish between the two types of stroke because the signs and symptoms can be similar. Your role, however, is not to diagnose the underlying condition or cause, even if you suspect that you have a good idea about what is going on. Instead, you must focus on managing any immediate life threats. Gather as much information as possible that will help emergency department staff determine the appropriate care for the condition. The information you provide can be critical because ischemic stroke patients can receive drug treatment that can minimize the effects of an ischemic stroke. However, the drug can worsen bleeding in the hemorrhagic stroke patient. The signs and symptoms of a stroke can include altered mental status, dizziness, headache, facial droop, difficulty with speech or vision, decreased or absent sensation, movement, or strength in one or more extremities, particularly on one side, and incontinence.
All right. What's your name?
A common assessment tool, known as the Cincinnati Stroke Scale, evaluates 3 patient characteristics to determine the likelihood that a stroke is involved. Any abnormality in any of the 3 characteristics strongly suggests that the patient has suffered a stroke. The 3 characteristics include facial droop, arm drift, and abnormal speech. To assess facial droop, ask the patient to look directly at you and show you his teeth.
First, I'd like you to give me a big smile.
Note whether the face has normal symmetry or whether there is a drooped appearance on one side. To assess arm drift, direct the patient to hold both arms straight forward for 10 seconds with his eyes closed.
Keep your arms just like that for me.
Watch for one arm to drift downward while the other remains in place. To assess abnormal speech, ask the patient to repeat a common phrase, such as,
You can't teach an old dog new tricks.
the patient may slur speech, say the wrong words,
How long ago did this start?
be unable to repeat the phrase, or misunderstand directions.
We were just sitting here talking and
To manage a stroke patient, immediately activate the EMS system or call for transport. The patient may exhibit tongue deviation, a condition in which the tongue leans to the weakened side after a stroke. This can make speaking or swallowing difficult or even obstruct the airway. Assess and monitor the patient's ABCs. Monitor the airway and prevent the patient from eating or drinking. Administer oxygen according to your local protocols. Provide ventilation if needed. If the patient has experienced any weakness or a decrease in movement in the arms or legs, keep them still to protect them from further injury. Shock, respiratory arrest, and cardiac arrest could follow a stroke and rapidly change the course of patient care. Monitor the patient while waiting for further help, being alert for any deterioration in her condition or mental status. Be especially attentive to the patient's airway, breathing, and circulation. Repeat vital signs and record any trends or changes in the patient's condition.
Sorry about that.
Provide emotional support and keep the patient at rest. In some cases, the patient will appear normal when you arrive, despite having been reported to exhibit confusion, difficulty speaking, and weakness on one side. This patient may have experienced a transient ischemic attack, or TIA, caused by a small clot that temporarily blocks circulation to part of the brain. A patient who has suffered a TIA will have typical signs and symptoms of a stroke. However, when the clot breaks up, the condition resolves and the patient appears to be fine, often within 10 to 15 minutes of onset. Often, a TIA patient will refuse further help. However, she is at risk for having a more serious stroke. Encourage her to be evaluated as soon as possible in order to prevent another stroke. Neurological emergencies can present some of the most serious life-threatening patient conditions. Altered mental status is a critical symptom that can alert you to important underlying issues. Seizures indicate the presence of a sudden alteration in the brain's neurological function, and strokes can lead to permanent disability or even death. In this program, we have presented the signs and symptoms of altered mental status and types of seizures and strokes. You have seen the importance of assessing mental status and conditions that may alter a patient's mental status. You have seen different kinds of seizures and their common causes. You have seen how to assess and care for seizures. And you have seen the signs and symptoms commonly associated with stroke and how to provide emergency care for stroke patients. You must be alert at all times for any indication that your patient is suffering from an altered mental status. This is a key indicator that there is something seriously wrong. It is important that you are able to quickly assess and provide appropriate care for these patients.